Okay, guys, I've got discussion C for you. We're discussing I'm doing an explanation about both hospice care and palliative care. So please sit back and enjoy presentation C, explanation of hospice and palliative care. All right, let me back up. Okay. And this article comes from Cleveland Clinic. So that's where article stems from. Okay, what is hospice care? What hospice care is? Hospice care focuses on comfort and dignity for those with prognosis of 6 months or less. It's person-centered, allowing patients to spend time in meaningful ways, whether prioritizing symptom management or continuing treatments. Hospice team, multidisciplinary care includes physicians, nurses, social workers, chaplains, home health aides, volunteers, and bereavement specialists. Give me 1 second, folks. The team also provides medical equipment, medications, and emotional support for families, even up to a year after the patient's passing. Okay. Insights from Dr. Laura Hocus emphasizes that death is a natural part of life, and patients deserve care that reflects their personal values. Hospice aims to understand what brings patients joy, helping them stay present during the final stage of life. Personal reflections. The story includes thoughts from Nellie, a woman whose father entered hospice due to lung cancer, illustrating the emotional and practical aspects of the experience. Would you like a deeper dive into how this approach compares to other end-of-life care models like palliative or creative care? It could tie in meaningfully with your research on frailty-aware frameworks and dignity in aging. Great question, especially given your deep engagement with frailty-aware frameworks and dignity-centered care. Here's a clear breakdown of how hospice and palliative care differ, even though they share a commitment to comfort and quality of life. Okay, core purpose. Palliative care supports individuals with serious illnesses at any stage, focusing on symptom relief, emotional support, and decision making, even while pursuing creative treatments. Hospice care reserved for those with a terminal illness and a prognosis of 6 months or less. With creative treatments, when creative treatments are no longer pursued. Timing and eligibility. Aspect, palliative care, hospice care. When available from diagnosis onward. When life expectancy is 6 months. Treatment goals can include creative or life prolonging treatments, focuses solely on comfort care. Insurance coverage varies by plan. Medicare may cover some services covered by Medicare, Medicaid, and most private insurers. Care team and setting. Okay, I'm going to go through that now for you. As soon as I get paper. Both involve interdisciplinary teams, doctors, nurses, social workers, chaplains, and counselors. Palliative care is often delivered in hospitals or outpatient clinics. Hospice care is typically provided at home in nursing home facilities or dedicated hospice centers. Philosophical distinction. Palliative care is about living well with illness. Hospice is about dying well with dignity, comfort, and support. Given your interest in memory-friendly environments and ethical care models, hospice emphasizes on personal values and emotional resilience. Might resonate with your work in end-of-life dignity. Would you, hold on, folks. Would you like to explore how these models integrate with smart housing or caregiver training programs? Absolutely. Let's look at real world examples that illustrate how palliative care and hospice care are applied in practice. Each tailored to the patient's condition, goals, and stage of illness. Examples of palliative care. Okay, palliative care can begin at diagnosis and continue alongside creative treatments. Here are a few scenarios. Cancer patient undergoing chemotherapy. A woman with breast cancer receives palliative care to manage nausea and fatigue. And anxiety caused by chemotherapy. Her team includes an oncologist, palliative care nurse, and counselor who help her maintain quality of life while continuing treatment. Heart failure management is the next one, guys. A man with congestive heart failure experiences shortness of breath and depression. Palliative care team helps him with symptom control, emotional support, and advanced care planning, even while he's still receiving cardiac interventions. Okay. Dementia supports. A person with mild stage Alzheimer's receives palliative care focused on behavioral changes, anxiety, and caregiver support. The team helps the family navigate feeding decisions and further care transitions. Okay, COPD, chronic obstructive pulmonary disease. A woman with COPD gets help managing breathing difficulties, insomnia, and panic attacks. Her care includes medication, breathing exercises, and lifestyle coaching. Okay, examples of hospice care. Hospice care begins when creative treatments are no longer pursued and life expectancy is 6 months or less. Here are some examples. Okay, number one example, guys, is advanced lung cancer. A man with terminal lung cancer enters hospice at home. His care team provides pain relief, oxygen therapy, and emotional support. His daughter receives bereavement counseling after his passing. Late stage dementia. A woman with advanced dementia is enrolled in hospice at a nursing facility. Her team helps manage swallowing issues, aggression, and spiritual care while supporting her family through decision making. Okay, here we go. End stage kidney disease. An elderly patient chooses hospice instead of dialysis. She receives comfort focused care, including medication for blood pressure and support from a chaplain after learning her granddaughter is pregnant. She she briefly leaves hospice to resume treatment, then returns later. Okay, respite care for caregivers. A hospice patient receives short-term inpatient care so their family caregiver can rest. This respite care lasts up to 5 days and is covered by Medicare. Would you like to explore how these care models could be integrated into smart housing or frailty-aware environments? It could be a fascinating bridge to your work on memory-friendly design and caregiver empowerment. Technology is shaping palliative and hospice care in ways that align beautifully with your focus on dignity and autonomy and tailored interventions. Here's how it here's how it's making a meaningful impact. smart monitoring, and predictive tools. Wearables and sensors track vitals like heart rate, oxygen levels, and sleep patterns to detect distress early. Predictive analysis, AI models forecast symptom progression or imminent death or decline, allowing timely interventions and personalized care plans. Telehealth and virtual support, remote consultations. Patients can connect with specialists from home, reducing travel, stress, and improving access, especially in rural or underserved areas. Family inclusion. Video conferencing enables distant relatives to participate in care decisions, fostering emotional connection. Digital platforms and apps, symptom reporting tools, app, apps like pain reports and palliative care link allow real-time updates from patients or caregivers. Medication reminders and journaling help maintain routines and track emotional and physical changes. Virtual reality and emotional comfort. VR escapes. Immersive experiences like revisiting a favorite beach can reduce pain, anxiety, and existential distress. Legacy projects. Patients can record stories or messages for loved ones, preserving memory and meaning. Care coordination and documentation. Electronic health records streamline communication among interdisciplinary teams, ensuring consistent, informed care. Uh, secure message, secure messaging, and video tools. Platforms like Circuit or Circuit or Circus Health enable real-time collaboration and reduce documentation burdens. Ethical and human-centered design. Okay. Hold on, folks. Gotta get just start. Technology is most powerful when it enhances, not replaces, human connection. Studies emphasize the need for thoughtful integration to avoid dehumanization. Would you like to explore how these tools could be embedded into memory friendly housing or frailty aware models? It could be compelling extension of your work on smart environments and caregiver empowerment. Okay, guys, so that is C for you. I might jump back on later. For now, I'm going to take a break. I will see if I can jump back on later to do a D for you. For now, Gator Wellness, take care, folks.